Hi, so my name is Chris Lockyear. I'm the Secretary General for Médecins Sans Frontières.
And my name is Remi Carrier. I was the emergency coordinator in Gaza for the past 5 weeks, and I just came back from Gaza over the weekend.
Hi, my name is Ibtisam Azim, Al Arab Al Jadid newspaper. I have two questions. First, since you came back from Gaza, if you could elaborate on what you saw and we saw the news, but if you could elaborate more. And the second question, in your remarks to the Security Council, you talked about the fears that your colleagues on the ground are having because of your statement today, that there will be maybe also repercussions or whatever steps against them more than you already facing and the bombing. Could you elaborate on that? Thank you.
Sure. Our staff are living in fear on a daily basis, and what I talked about in terms of the incident that happened 2 days ago is an acute and contemporary example of that. We've had multiple incidents, as I said, in terms of we've had two incidents now where our staff shelters have been hit. We've had our convoys attacked. We've had bombs into our hospitals, and so I think it's only natural that the people who are staying behind, working every day for our patients, are seeing this fear. They're seeing this pattern, and they're terrified on a daily basis.
The situation in Gaza overall is deteriorating weeks after weeks. I think aid is not entering at the level it should. People have really little chance to see their situation improving, and they are scared. Today there is no safe place in Gaza. There is a big part of the country that is not accessible. People now start to move from Rafah to go into middle area, and we see more and more people going into places that are not safe areas neither, and where it's very difficult for aid to be able to support them. Everything is so fragile from food perspective, and getting truck in the north is becoming very difficult, and WFP decided to pause these actions. On the medical side, you don't have hospitals anymore. You don't have maternity anymore. You don't have primary health care anymore. The number of hospitals that are remaining cannot cater for the needs of the victims or the people that are sick. Cancer people, you don't hear about them anymore. Where are they? If you are a pregnant woman and you have to go through a cesarean section, today, 4 hours after, you have to go back home. There are no beds. Having treatment like diabetes is nearly impossible. They have to reduce the number of hours to treat a diabetes patient because there are not enough treatment available. Supply chain is, of course, a big problem. How can we get these 2,000 trucks that are at the border to come in with the essential goods for this population? How can we scale up these activities? So this is the only hope for the people, is a ceasefire would allow them to rest, to sleep, and to get proper treatment. Yeah.
Could you just tell us how long you were in Gaza?
I've stayed 5 weeks there.
And it was just in the south, or were you able to go everywhere?
So no, going everywhere is not possible. So we were located with our projects mainly in Rafah, but we were supporting the hospital, Al-Aqsa Hospital, which is in Dar el-Bala.
Hi, Cullum Lynch from DevEx. Can you give us some sense of, there's been a lot of discussion about suspension of funding from UNRWA. For UNRWA, they handle the primary care, not the tertiary care, but you have any sense whether that's having any immediate impact on the situation on the ground? And also, there's been a push by Israel and the US to supplant a lot of the functions that UNRWA carries out by other UN agencies, WFP, WHO. Is that an issue that you guys, I know it's more of a long-term issue, but is that become a problem?
On daily basis, I don't think that a lot of humanitarian organizations could function without the services by UNRWA. simply, you need fuel, it's UNRWA organizing that. You need storage, they help you with the storage. So a lot of the services that everybody is receiving is because UNRWA is functional today. I don't know in this present situation who could be able to hand it over and to make it work as they are.
Thank you.
Thank you to you.